I'm a CEO and co-founder of Magnimind Academy. So we've been doing a lot of AI and data science training, and we do boot camps, and we do a lot of lectures, seminars, webinars. We have organized over 100 free events for people. We're located at Silicon Valley, but we expanded after COVID. We expanded all around the US and some European sites. And the AI Health Talks we started last summer, just around the beginning of COVID. Sorry, we have a lag button. And then now we resumed for a couple months, and now we are starting again. So we are broadcasting in several channels in YouTube, Facebook, and so many others. And you guys can watch the recordings later. And what our goal is, we want to bring the two different industry, like a healthcare and AI and data science industry, and make some synergy, so some things come out of it. And we learn ourselves a lot of things from that AI talks, and we get a good feedback from our audience too. There's a lot of actually good collaboration started with it. And I hope it goes well from now on too. So I will let Chirag actually make the introduction, and then we can go from there.
Okay, do you want to introduce Ryan as well, or should we introduce ourselves, or?
Yeah, actually, we should do that. Each one of us introduce ourselves.
Okay, maybe Ryan, if you want to go ahead.
Oh, sure, happy to. Yeah, so I'm Ryan Spitler. I direct the Precision Health and Integrated Diagnostics Center at Stanford, and we try to keep people healthy for as long as possible through continuous health monitoring approaches.
And my name is Chirag Patel. I'm a clinical assistant professor in the neurology and radiology departments at Stanford, and have known Ryan and Murat from the time we were postdocs together at Stanford. So we're looking forward to the opportunity to introduce our speaker today. So we wanted to really thank Nicole for joining us today. I'll give a little bit of background about her organization before I introduce her. So Health and Human Rights Strategies is an independent international institute that works to promote the advancement of healthcare and human rights by providing actionable research, nonpartisan analysis, and strategic planning for the most pressing health and wellness challenges. And Nicole Roberts is a human rights and public health advocate and on global health innovation, human behavior, and reform, specifically as they impact vulnerable populations. She contributes to numerous magazines, highlighting ideas, advising companies, and promoting people that are changing the health landscape. She has a doctorate in public health from the University of North Carolina, a master's in public policy from the University of Chicago, and she completed undergraduate work in psychology and biology at the University of Missouri. Her talks can be found on the United Nations website and various news outlets. She serves on several boards for domestic and international health organizations and frequently speaks on global health reform, innovation, human rights, and the context surrounding health. So we're really excited to welcome you, Nicole. Thanks for taking the time, and we're really excited to talk to you today about how your work intersects with AI.
Thank you for having me. It's funny when you hear someone read internet bios, it's like Instagram, but for career highlights.
Exactly, right. It's like
so much other stuff that happened in there, but I love the takeaways.
There we go. It's like, let's highlight the high points, but hopefully we can go into more depth today, and that'll be great. So could you tell us a bit more about your organization and, probably fill in some of the gaps that I wasn't able to, get into with the introduction?
Yeah, so I think that was great. I was like, wow, they know a lot about me. So yeah, I started out thinking I was going to be the greatest neuroscientist ever. And then something hit me when I was thinking about, medical school, and I just hit pause. And instead, I took a swerve and decided to get a master's in public policy. I had this moment where I had this fear that I was going to end up writing prescriptions for a living or something like, and I kept thinking about what is medicine, and you know, through undergrad and whatnot, and you know, pre-med, you've got this like laser focus, and I don't know what happened. I just sort of panicked, I guess I would say, and I decided I thought I could have a bigger impact if I could change the system and try to make the world better for everyone. And it was a bit lofty. And then I decided for my doctorate to merge those, and I got a doctorate in public health, and was at UNC, the School of Global Public Health. But I've always viewed everything I do through that original lens of human behavior and behavioral science. And for me, even now living in Washington, D.C., you know, I always try my best to be a voice about building policy for real humans and the way we actually behave, as opposed to how we often write policy, which is people should do X, Y, and Z. I mean, we're in the middle of a pandemic, and I think all of us speaking today are currently living in the US. And so I think we have a plethora of examples of humans not behaving rationally. So I think there's a lot that technology can do, but I also think along with the opportunity, there's risk. So I'm really excited to have that discussion. What I do on a day-to-day basis ranges everything from I host a brain health summit at the Super Bowl to a couple weeks from now, I'm starting a podcast. So I will, there's a part of me that's going to constantly be monitoring everything you're doing today and learning from you. It's going to be a global health podcast. And it comes from all the work I've been doing internationally from almost 2 decades now. But with the, you know, restrictions in travel, most of the work I was doing overseas in education, clean water, food insecurity, it's hard to do. And I'm having to do it from DC. And so I thought there's a really great opportunity here to do just what you're doing, which is communicate. And if I can't be on the ground doing work, I can at least take all the things we're talking about and learning about and then communicate them to people who are just curious, or people at home, people who have questions about how, just as you said, all these different things intersect.
Well, that's great. Well, thank you so much. I mean, we're really looking forward to this opportunity because a lot of our past speakers have been talking from the perspective of industry or science, for example. But I think a lot of that is underpinned by the work that you do in terms of, you know, public policy guidance. You know, how do we make laws that are kind of more, let's say, consistent with, like you're saying, human behavior, not trying to enforce or, you know, dictate human behavior. So could you tell us a bit about that in terms of the work that you're doing, especially with you being based in Washington, D.C., where you have access to all the, you know, policy makers and the legislators, how that process works, and, you know, even some of how the work that you're doing may intersect with AI and some of the concerns that are emerging about the use of unfettered AI surveillance, for example.
Yeah, I think that's a great word. I think that's unfettered is a really great word for what's sort of driving people's immediate responses. There's certainly a lot of fear that's associated. But in terms of DC, it's difficult. It's, I guess, maybe taking a step back. When I moved here, I think originally 11 years ago, ballpark, somewhere like that. I came to DC like a lot of people thinking, oh, Capitol Hill is 0.6 miles away. I can go to Senate and make a difference. I could, you know, it's a lot more difficult than that. And I think what a lot of people don't realize is even when it comes to, say, a good clinical study, right? You have to take that information, or when looking at AI, you have to take that technology, you have to take all the complexity and nuance that's in technology and in healthcare, and you have to, in most cases, get it to a couple bullet points that's originally presented to a 20-something who's an aide. And they're only living here. I think DC is the most transient city in America, last time I checked. So you've got to think, I mean, the turnover is just constant. And so even like the people coming in, working in offices and staff, a lot of them are here for a couple of years, and they're maybe doing an internship right out of undergrad. And that's not an insult, but that's a very different conversation and experience than showing up in your senator's office and presenting them with something absolutely beautiful that they can then march, into a congressional hearing and do something about. It doesn't really work that way. It usually starts with getting on the calendar, which, I mean, during COVID is near impossible, right? Getting on the calendar of an aide who, good chance, has zero background or knowledge in any of the things you're going to be talking about. And you've got to present them in a way that they can not only absorb it, but understand it and give it to someone else in line, their immediate boss, or the person in charge, power that we're trying to influence. Honestly, it's an absolutely brutal process. And getting back to why DC is the most transient city, I think a lot of people after a couple of years reach a point where they just feel like they don't have influence. They're not going to have the voice they thought they could. They're not going to be able to make the difference they thought they could. Then you add in, turnover in administration. And even though we have a lot of incredible employees in government, the heads of each agency change every, I don't know what kind of timeline we're looking at these days. There's a lot of turnover in heads of agencies as well. And they all have their own agenda, for better or worse. So it's exceptionally difficult. And I would say the intersection of areas that you specialize in are some of the absolute hardest to communicate. And again, I said, with opportunity, there's also risk. And there's something about AI that people are really hesitant about. They're very fearful. It conjures up lots of unknowns. And in all honesty, we have to acknowledge there's a lot of unintended consequences. And we learn as we go, but people are really, really hesitant to embrace AI, more so than I actually thought.
Yeah, I mean, we've been talking about a lot of AI technologies, and everyone is doing such great work. We have also some projects in ophthalmology, neuroscience, and brain cancer. The problem here, we work with a lot of different hospitals. We try to reach out hospitals and universities. People so hesitant to share the data. I say, oh, can we work with your eye images, de-identify them, okay? And I'm looking for something cool there which will help people. So people are so, one is afraid. Second is they feel like they're giving out something that is worth something and they don't know what, and they don't want to give out. So, and same thing goes to university policies or government policy. Oh, there is something that we should not give out. But in our aspect and as a data scientist, we need this data to just develop some model. It will help patients. So you're gonna even prevent blindness from it. If people just hear, they can see the glaucoma or some other eye disease or brain cancer from some of the AI-based method. A lot of people just, you will save people's lives, you will save people, blindness. So there is a lot of unclarity here and a lot of hesitancy. Do you see that is happening, and what is the action need to be taken? Is people working on to fix that problem?
Are there people working to fix that problem? Yes. Are they getting a lot done? Hard to say, particularly in the current dynamics of things. I'd say this is suboptimal environment. In fact, my dissertation I wrote on public-private partnerships in science, and in neuroscience specifically. And I was shocked originally to find out that in global health, we do public-private partnerships pretty well. right? Rockefeller, Gates, right? We've got these huge international projects for TB and things like that. When you look at, to your point, even sharing data from Stanford to the University of Chicago to, you know, somewhere else, it's almost non-existent. And when I was doing my dissertation, I remember one of the things that really stood out to me, and you just touched on this, and then this is my way of saying it, it's kind of everybody's fault at the same time. Intellectual property came up as probably the #1 theme across hundreds of interviews across public, private, government entities all over when it comes to neuroscience. And intellectual property is a lot of different things. I mean, the value that an academic has in publishing something is huge. And the government doesn't respect that at all, right? The return on investment that the private sector needs to justify doing something also doesn't make sense to government or to academics. It's like what IP is, what's valued is so different across the sectors that, like, the CDC has an office that is literally the Office of Public-Private Partnerships, and it sits in the director's immediate hub. I mean, that's how important it is to the CDC. And yet, I had expected with the pandemic, as an example, this administration in particular, I expected them to embrace public-private partnerships from day one and let them run wild. And they really didn't. Even when it comes to, you know, protective gear, when it comes, like, there's so many places that people could have partnered and shared, and I think accomplished 10 times more in half the time. And it just didn't happen. It was really heartbreaking for me, to get to your question of, to me, that if people didn't embrace it and take advantage in that opportunity, that doesn't bode well for, are we making a lot of progress in understanding how to move things forward in a partnership style manner. And there's also now, sorry, there's lots of sirens if you can hear that. I mean, the public in DC in particular, I would say, is science right now is so weaponized, and the conversations are even difficult to start. People come in with a set of biases and assumptions before you even really are able to present good information. And it hurts to say, but it's how I really feel right now.
Yeah, it's hard there's a lot of bureaucracy, and it's also a lot harder to work with different sectors, especially like when Cancer Moonshot project, I don't know if you're aware of. So
I know Greg Simon well, who ran the Moonshot. Yeah.
Yeah, that started really good, but I see that that slowed down, you know. It's really hard to maintain. But what is really good, especially in the genetics area, the cancer database, and that works well. I mean, we use that database. We just derive some information from that. In there, when NIH actually, when they give grant in that area, they actually expect and require people to just put data up there. And maybe in some other things that kind of initiatives could be done, but in terms of the going public, I mean, hospitals, some private universities, a bit hard, I guess.
It would be, until people's values are aligned, it's going to be really difficult.
And there's actually a really good question from the audience here. It's from David. He's asking, Nicole, if you're in charge of public health messaging to encourage mask understanding, mask selection, and mask use to reduce the transmission of the SARS-CoV-2 virus, and mask enjoyment to continue beyond the beginning of vaccination especially, what would you do differently? And how would your choices be influenced by what's been learned from the anti-tobacco campaigns, where American television public service announcement ads aimed at young people are very different from what they were 20 years ago?
Yeah. That's a great question. In fact, I have only remained on one task force since the start of the pandemic, and it is a communications task force. It's a really cool group of people. It includes, like, I don't know if you guys know Ogilvy as a PR firm, the head of their behavioral science unit, Chris Graves. I mean, just people like that who are just absolutely, you know, the heads of their field when it comes to human behavior and public health communication. So we have a call every other week. We spend an hour or more working on messaging. So going back, day one of the pandemic, I attempted, again, didn't go anywhere. I attempted, before people really embraced social distancing, I tried to push for physical distancing and social connectivity. To me, that would have made all the difference. It's physical distance. It's not social distance that we want. In fact, telling people that they have to stay apart physically means they need more intimate personal connection. And so for me, that was a simple word switch that actually reframes how you think about what we're doing. I also, obviously, the visuals matter. I sent a very frantic, angry text to a friend once in the White House during one of the meetings that was happening. And I said, you have 7 people crammed on the tiny press stage telling people to wear masks and social distance, and none of them are wearing a mask, and they're shoulder to shoulder. I was like, it doesn't matter what's coming out of their mouth. You're communicating. I said, move it to the red room, move it to the, pick one of the big dining rooms and spread out and put on a mask. That visual is going to speak far more than the words. And eventually they did, but I think going back, there are lots of things that could have been done differently that are small-ish in and of themselves, each one, but could have been exponentially important in communicating what we needed to do. That said, I will say, I think one of the greatest examples of mask wearing that did actually turn the dial a little, and I never would have predicted this, had nothing to do with it, was NASCAR. Once all sports were canceled, people were like, how are we going to sport back? How are we going to sport back? And of all, I don't know what you call leagues. I don't watch NASCAR. Whatever this sport industry is, for NASCAR to be the first sport back, especially given their viewer demographics, to see the drivers walk, down their road, all wearing masks, all socially distant, all men, manly men. Like, I was like, this is cool. I was like, this is visually a public health message that is so powerful, and it's targeting the exact group of men we're actually struggling with the most. And just a little bit of insight on that. That has been consistent. Normally, with something particularly like mask wearing, when looking at men in America, and mostly just speaking, to the American audience right now, you can appeal to men by saying, like, look, you may think this is silly, you may not like this. It's not that big of a deal, and it protects your wife, it protects your kids. Add in parents, fine, but kids, do it for your kids. Dads will, dress up and do tea parties for their kids, anything for your kid. That hasn't worked at all. It didn't move the needle at all during this pandemic, which I think then speaks to however we have been assigning manliness or family values. It's really different right now than it has been in, the number of examples we can think of. And you asked about smoking, and I would say, that's something. Do it for yourself, do it for your health, but also do it for those around you. We started learning so much about secondhand smoke and what it does to your family. And it's like, even if you're going to have a cigarette, cut back, go outdoors. Don't do that to your kids. Don't do that. Whatever's going on, and I have a few theories, but with masks, those normal messages, those normal A leads to B mentally, processing, haven't worked. It has been the most frustrating. And like I said, I mean, we've got some of the best people on this task force. And it took a lot of us stepping back and going, nothing we've done before is working.
I think a lot of the information, obviously, like you mentioned, I think I really agree with you. I've been referring to this whole concept as physical distancing from the get-go, because that's just what it is. But I really like how you mentioned that really forces everyone to really have more strengthened social networks, friends, family, et cetera. So, a lot of people are using social media to connect, with each other. But then also, as we know, that's also a vehicle for spreading misinformation, especially as it pertains to public health, for the benefit of everyone in the society. So are there any kind of anecdotes that you have or experiences that you've encountered where, or even recommendations you have for some of these social media companies that are, putting their flag in the ground saying, well, for any misinformation about the vaccine, we're going to block that, very selectively and very aggressively. But for other types of misinformation regarding maybe masks or something else, they may not police that. So is there any guidance or any kind of best practices for how to, kind of decide when to self-police or not self-police, when all of these individual components are maybe equally important, not just one of them, to help really reduce the risk of transmission and, worsening on the burdens on the healthcare system, for example?
That's really tough. And I say that in real time this is one of those things where it just depends. And I know that's not a good answer in any way, but I hear one thing and I'm like, they should not allow that to go, to spread what. And then there's the other side of me that's like, where's that line? Where's that line of, if an epidemiologist presents something that isn't quite in line with what we've been hearing, do we shut that down? Or is this engaging public discourse? And in fact, if someone's presenting this idea, then you can bet a whole lot of people have at least had that question run through their mind. So is it better to let it exist and then combat it and say, here are the reasons that fails whatever test, we're applying to it? I don't know. And honestly, I don't know how these huge companies go about drawing that line. And I know, Facebook, Twitter, they've all got ethics boards and committees, and how that process works, I don't know. And I don't have advice for how it should work. That's hard. I think that is a place in terms of, talking about AI and opportunity. I think some of the places that people are hesitant about AI, this is where we really need to be demonstrating, here's how we can apply ethics, right? And how an example that immediately comes to mind for me is we're starting to see a trend where the QAnon movement in places and communities where it did really well with its messaging around the election, it has very seamlessly started working in anti-vax information. And so I have thoughts in my head that I'm not saying out loud. I'm trying to filter a little here. And so in that case, it's actually predictable because the messaging streams and threads and words, the way they organize their arguments, they're really easy to predict. And they say this one succeeded, this one succeeded, this one succeeded. We literally just have to sub in XYZ, in place of ABC. And people are already buying into their messaging. And there are some that honestly, if I hadn't seen them myself, I wouldn't have believed them. If you said, oh, I hear people are saying, I would have been like, you're nuts. But then I talked to one of my friends who's, a doctor, and she's like, oh, 3 people turned down the flu shot in my office today because the Biden administration has already inserted this chemical with coronavirus, whatever, into it. I'm like, I'm sorry, what? And I mean, but then you start seeing that it's very tied to the political language is now being tied to the anti-vax movement. So that's a place where I think technology and these companies, there are trends that are predictable. And when those start happening, there are places where you could be like, okay, this is just not real. And yet I would actually argue some of those fact check things that they did pre-election somehow like empowered some of these groups. It was like people really enjoyed, they're like, you say I can't share this, then that proves it's real. And it turned logic, like mental gymnastics, and yet it created this whole subgroup of the more you try and censor misinformation, the more it proves that misinformation is real. So I think there's a real place for technology in there to help us understand what's happening and predict it. Some of the troubles there come with biases, and we know that exists. So that's a challenge, but I think ethical boards can help explain what they're doing. I mean, transparency at the end of the day is the best we can do. Education.
The problem with sometimes technology, especially AI, if you train the data with different groups, and then your fact checkers will be wrong. So
Yeah.
just you may block all the right things too. Let's say there's 40 million people just talking about misinformation, and then they have the wrong information they're spreading. Then AI will grab that, and then this will be reality. It will be weird, but that may happen.
Yeah, I don't know how anyone. I don't envy any of those people in decision making or power positions when it comes to how to apply rules to fight misinformation and disinformation. I mean, just very intentional disinformation campaigns. We're seeing a lot of that in India. WhatsApp has actually been a lot of the work I'm doing in India. I would like to just throw WhatsApp out the window for a while and cut off some of those lines of communication, but that's not how it works.
So that brings the question that you're interested in also in international policy. Maybe there's some things will be easier than just checking across around the globe what countries, what policies they implement, how successful they are, and maybe like as a United Nation or some other international groups, they may adjust the policies and then maybe recommend the governments on that, because you cannot change the United States, but that some certain policies may be easily implemented in Sweden, and then that work well. I think that may work at some degree. And then you just bring that up here, especially new government, they are more open to international policies. They may implement some things like that.
Yeah, maybe.
There's another question here coming in from the audience from Sid. It says, when considering general human behavior, do you think that there are tactics we could use to assist in this issue with misinformation that help reduce alienation and thus push towards tribalism and radicalism rather than pushing towards censorship?
That's great. Thank you for following up with that. That is the ideal state, right? Where we don't even discuss censorship in any way because we believe in freedom of speech, but we're just not dealing with a lot of these issues because people are more informed and more open and compassionate. It's a bit more grace in the world. That would be nice. The difficulty there, I would say, I hate being pessimistic. I always try and be solution oriented, but we're in a place right now where, some people even argue that once the election was over, there might be more unity. We haven't seen that at all, right? We've seen actually even more people going to the extremes. When people are scared, when people are fearful, tired, they look for the easiest path possible. And Chirag, I'm sure you know all that, right? Like it's really just emotional and mental exhaustion is real. And our brain just looks for the shortest pathway, and it looks to fill in the gaps. You can tell a story, and if there's any gap in the story, we're going to make up what is easiest to fill in the gap. And that's just humans. And we're going to human, forever. That's just how we are. With that said, we're in a place where people are fearful. They're frustrated. It's going to be really hard to pull them away from the extremes until we change their emotional and mental state. It takes bandwidth to be empathetic. It takes a skill set. It also takes bandwidth to be able to go from A to B to C, as opposed to just black, white, yes, no, good, bad. That's easy. It doesn't take thought to have either or. To be like, oh, food insecurity leads to families making hard decisions. Hard decisions mean girls in particular often end up in exploitative situations where they can't go to school or they get put to work, or right, those sorts of things. And that's the kind of work I do, which is like, we're addressing food insecurity. What we're actually doing is preventing exploitation of girls. But it's so hard to have people walk down that pathway with you. You've got to just make it super easy. And we've seen all those sorts of initiatives and efforts absolutely plummet in 2020. Even in our simple fundraising, just any messaging that is hard, people just stop donating. People, and I know a lot of it, there's a lot of financial and insecurity right now, but my point is, what we're finding is people are desperate for really, really easy yes, no right now. They're not, which is why I said I hate being so negative, but I mean, people right now, they're just not interested in hard, complicated, thoughtful engagement. It's easier to hit share. It's easier to pick a side. So I don't actually see it changing until we've got some wins under our belt, until people feel safer. That makes sense.
I think it's an important link that you mentioned in terms of food security and financial security, being some of these determinants of anxiety and fear that do drive people to these extremes, like you're saying, and then you go into your two camps, and then there's that middle group just disappears, and then everyone's kind of in their own isolated, I don't want to use the word bubble, but on their side of the argument or whatever it is. But I think, getting to your point about messaging, there's a comment here from Robert, who says that for Americans to accept AI data donor an AI data donor mentality, you must first show them a powerful reasoning metric. He plans on explaining to consumers that all of the data donated will be used to build the models that will constantly examine all of the past illness data every single time the model gets updated. It will do it in the background so that a quote unquote AI doctor gives a current and past checkup all the time. Let the consumer know that AI can operate as a check engine light for things that you might not be able to detect in the present, but it can be detected in totality. And he kind of follows up to say that another audience member here named Adam says, the best defense against disinformation is a widespread individual commitment to reason and evidence. People choose misinformation because it validates their ideas and because they don't want to investigate further, just as you mentioned exactly.
Yeah, it's easy. Kind of it's easier to be validated than to seek out information and have your preconceived notions challenged. That's hard. It actually like hurts your brain to process. It hurts you. It hurts you to hear that you're wrong. So, but that also gets back to the question about masks. I mean, for better or worse, you can't shame someone into agreeing with you. So it doesn't matter how frustrated I've gotten going on somewhere like Twitter and saying like, you're an absolute idiot if you don't, literally will change no one's mind. You have to kill them with kindness, bring them along sugarcoating. The best message converters are people who, this kind of bridges a couple of the questions, the best message or behavior converter is the messenger who was in your camp and now isn't. It's actually easier for you to cross over when you've heard someone else say, I was here, here's what happened and why I'm here. Because then you can empathize, and they also, because someone else has already like moved over, you don't feel as wrong. You're like, oh, I'm sorry that your 15-year-old, got whatever and passed away. You feel it, and you're like, now they wear a mask, now they, whatever, it is. So if you can do good storytelling, and if you can get those convert communicators, that task force I mentioned, No COVID, we, the group has been so great about looking for the big messengers, your celebrity, your whomever that really registers with people. And that's no different than like 3 former presidents saying they're going to get the vaccine, right? Watching Obama, Bush, Clinton get a vaccine is going to speak to different groups. And yet at the end of the day, it needs to be someone from your community. So the used car salesman or local high school football coach telling you they're wearing a mask, and if you're going to come to their lot, you need to too, because it's just the thing you do. That actually resonates a lot more than sometimes even like a president doing it, because it's someone that you use. Car salesmen of all things really resonate with people, and all I can think is it's because they've heard their voice, and they've been, in most cases, applying stereotypes like the good old boy for so long, that when they say like, well, I'm going to do this thing, it's like, oh, okay, well, if the good old boy's going to do it, I guess it can't be that bad, right? And that's the sort of thing that gets people to move from one camp to another, or lower their barrier. You can't call them stupid. It doesn't work. In fact, they'll just, double down or move even further to their corner. Ryan, you're really quiet.
Well, I guess, I guess, you guys are all bringing up great points. I think one of the things you mentioned that is kind of from the other side of it was to kind of make them comfortable. So do you go after like, when you can go after a lot of different problems, different aspects of any problem, but do you do it like kind of in clusters? Like maybe I'll do some initiatives that'll help them financially, some of them personally, some of them medically, all at the once, but kind of have that unified goal in mind when you kind of push these initiatives through? Or do you focus on just one and just go after that mostly? Or what is your overall approach? For just in a general way?
The former. So just because it's top of mind, it's my big project, the food insecurity project right now. For certain groups, I've been using the strategy that food is medicine. And when you look particularly at young girls, 7, 8, 9 to 13, 14, one nutritious meal a day makes all the difference in their physical, mental, and emotional development. You're literally solving medical problems by providing a nutritious meal. To other groups, it's that emotional sort of thread that I gave the example of, which is what you're doing is you're actually meaning that a girl has an opportunity to go to school. It means she has an opportunity to grow and to contribute to society and live up to her full potential. Right? That's a very emotional, community-centric, even really sort of forward-thinking economic argument that providing one nutritious meal a day means someone can go contribute to society, for the rest of their life. And then there's, the arguments of just the stats on food insecurity. And you can tie those very much. I have a whole American sort of focus on food insecurity in the US is in certain communities doubled, tripled since the pandemic started. People who didn't necessarily understand what food insecurity was now have an entirely new appreciation because people they know are falling into this vulnerable place where it may not be that you can't eat dinner tonight, but you're really insecure about how you're going to feed your kids through next week, particularly if your paycheck doesn't come on time. That resonates now in a totally different way that's awful. And yet it's created a whole new communication stream because people here now understand food insecurity in a whole new way that makes it easier. I can now understand why parents find themselves in certain situations other places. There's a whole empathy there. So yeah, how I even approach that is very different based on who I'm talking to and why. And that, I guess, makes, for me, it kind of makes it, I'm going to say easier, but because I obsess over those downstream effects, like clean water or food. There's lots of pathways as to why those are important to people, why these basic human needs have to be met. You can't have conversations about what type of mask someone should be wearing if they don't know where they're going to sleep, right? You can't focus on proper social distancing if someone doesn't have a home. If a mom and 4 kids are living in a car, that conversation is just, it's not resonating in the same way, right? They're trying to figure out how she can send her kids to school when they can't go to school and their car that they live in doesn't have internet. So people who are dealing with those kinds of problems, we're then asking them for things that are absolutely impossible for them to process, let alone adhere to.
Yep.
We're
There
down
are
to,
actually, sorry.
go
There,
ahead. I was going to say that we're down to like 10 minutes left. We want to definitely give you a chance, Nicole, to talk about your upcoming podcast and what you'll be featuring. But we want to kind of squeeze in one more question if possible. One comment here says from Amin, he's saying that other than calling people that may disagree with you or with public health recommendations or scientific recommendations as stupid, do you think all of our initiatives are making them feel stupid or manipulated by design? And in a sense, do you think we are to blame, or maybe perhaps those that use AI or those that use certain messaging strategies or campaigns, could those folks be to blame for what's causing the gap or the division?
I personally wouldn't have used the word blame. I would say we're all, when it comes to responses in the pandemic, I roll my eyes when people say, we're all in this together. We're not all in this together. There are people who are not in this. There are people who don't care. When it comes to how we communicate and how we collectively work together and build trust, then I would say we're all in this together. There's no one entity, one medium that's responsible for the collective misunderstanding or there's a lot of things at play right now. It starts with, again, getting back to my core, the basic, Americans in particular think healthcare is an insurance card. It's, at the end of the day, that's a piece of paper that tells you like who you can talk to, and if you talk to them, how much you'll pay. Like that's not healthcare. It's a lot of the things you guys work in and talk about, and how we care for humans. So when we can't even have a conversation without people completely missing each other, right, on what is healthcare, how we communicate public health is just, there's no one thing that's right or wrong. It takes consistent messaging that is backed by things that people understand. One of the most successful, there's some data from other countries that interestingly enough has shown, and here we had one that immediately comes to mind, like a message for mask wearing. And it was a person with a mask next to a kid wearing a football helmet and a uniform. And it was like, and it equated the two in a way that I was like, now that is brilliant messaging, because people understand that a helmet, does it prevent everything? No. Does it do a better job than nothing? Yeah, it does. And that, like, people get it. And so in football stadiums and things, to use that next to one with a mask, it automatically gets you. So, I don't think anyone's to blame. I also don't think anyone's knocked it out of the park. I think we have certain themes and threads like that one that when they hit, you're like, okay, they're doing something right. What is that strategy? What is that link? Because again, it's got to be something that you can cognitively, it doesn't have to be hard. You look at the picture, you look at the one next to it, and you're like, oh, it's not the only solution, but it's better than nothing, right? Like, got it. And so I think technology that allows us to make improvements is welcome. I think people want that. I mean, clearly, privacy, I heard someone say one, they're like, well, my privacy used to be a cabin in the woods. And it made me laugh. Like, literally, like, even in my lifetime, like, I have an uncle who would go to the woods. No, he was off the grid. He was completely private. No one knew where he was. No one could get a hold of him. What is privacy now, right? AI scares people when it comes to privacy, but yet they've proven over and over again, they will give up their information for convenience 100 times a day. If it's just like, I don't actually think anyone's ever read the Apple, like, here's our bio, here's a accept, right? So the more people can be transparent in really simple ways, people are actually, I think, going to hand over their information. They're easily, they just have to believe that you're part of the collective good. And then they're going to buy into every other messaging that you have after that. So we're not very, I guess you could go all the way back to saying academics aren't very good at communicating for the most part to the public. And now you have a whole generation of scientists, media, communicating people, but then you hear that someone's curing Alzheimer's every other day. And yet, Bush declared the 90s the decade of the brain, and here we are. So, sorry.
Yeah, I completely agree about academics not communicating enough to the general public. And there is a huge academic workforce there. If they really do well in that communication, I think it will work well. You can see that there are a few percentage of them outreaching the people.
Mm-hmm.
And if it this could be extended and generalized, this will make a big difference. So there are a lot of actual questions we may not able to cover though. There's something I want to make actually comment about it, the radicalization or misinformation through the social media, how that can be controlled. So my own observation after the COVID, people don't go out, stay in their homes, and they communicate the world through the media, social media. And what it happens, it increases their own bubble because they only communicate from their own groups. They find that they don't really go talk to others outside. They can see everyone else outside and from every view. So that is probably one downside of the COVID era.
And I actually joked a while back on Twitter that if someone could figure out a way to dismantle Twitter, they should win the Nobel Peace Prize.
Yeah.
But I also posted it on Twitter, so clearly I didn't really mean it.
Yeah, maybe Twitter can maybe create content that is also going different dimensions, but it's really hard to deal with all this information. A lot of people making comment about it. So we have a few minutes away, and there is last one actually a question that maybe covering up this conversation in general. Someone asked, how do you get impact first organization to open up and talk about their data flow collection, case management in the field? Is there any like a flow in there, or yeah?
The quick, and I don't mean this as a cheesy answer, but I find it to be very honest, is you've just got to align incentives. People will do what's right And it's particularly now, there's lots of opportunity because so many private organizations are, for better or worse, focused on social causes, even if it's just from a PR standpoint, right? I had no idea how many newsletters and listservs I was on until everyone told me how they felt about Black Lives Matter, until everyone then had a coronavirus follow-up, right? People are, organizations, private sector in particular, feel an obligation now to address public issues. So I think the time is really ripe to get them in particular to do things, or academics to share. But you've got to align the incentives. You know, to your point about economists in particular, you know, a lot of economists I know, they find the 2 or 3 who are very well known on like Twitter to be sort of like, okay, they're focused on that, right? They should be publishing more papers. They should be speaking at these conferences. And so the weight of public communication is not nearly as high, certainly not if you're on tenure track for any field, right? You know, tenure track you don't get points for converting a whole section of the population to mask wearing, right? You don't get tenure track for that. So until we align incentives, I think it's going to be hard, but I think we can do it for the public good. You just got to give people what they want. If you want something, you've got to be honest about what you want from your partner.
That's great. Thank you. We are actually almost done. I appreciate your time. It was very enlightening.
I know I'm really different than everyone else you've interviewed, so I appreciate it. I'm sorry I gave such long answers, but you tapped into something I care deeply about.
It's one of the most engaging discussions we have. Our audience has been really writing. I've been trying to read and catch all this conversation. I like that engagement, and it's stimulating. I hope it helped, and it's probably, hopefully, it will lead something good after that, and people can communicate through our channels. Thank you again for your time and our audience time and our other panelists' time. Appreciate it.
Yeah, and I'm easy to find. So I know you all had even tweeted, and so I'm easy to find. Send questions. I'm happy to engage with everyone because I learn just as much from everyone else because I stay in my little world. So I want to hear about all the cool stuff you guys are doing and collaborate on ways to get it to people who actually need it.
Sure. I think we should do another sessions like that. Thank you. So have a
great day.
Bye.